right, perfect. Good afternoon, everybody. We'll just give it a minute for folks to trickle in, but thank you all for joining us for our next day of our Latino Health Forum webinar series. So we're very excited to continue having great speakers talk about health equity and the COVID-19 pandemic. And we will be joined by Dr. Jeff Reynoso, who will introduce shortly, but thank you, everybody. Slowly trickling in. I do want to just give a brief announcement to folks who will possibly need Spanish interpretation. So for folks who are on their laptops or PCs, if you go to the bottom of your screen, there is a menu bar with a logo, a globe logo that says interpretation. You can click on that and select Spanish for Spanish translation. If you are on a mobile device, you will just click the more, the three buttons that say more or más, and click the interpretation option there. So we will be joined by our interpreter, Maria Galvez, who will now explain these instructions to everybody in Spanish.
Buenas tardes, buenos días a todos y gracias por acompañarnos otra vez acá en el foro del tenemos unos presentadores excelentes hoy día. Muchas gracias por estar con nosotros. Les voy a dar instrucciones acerca de cómo tener acceso a la interpretación simultánea. Si tienen una computadora, por favor, a mano derecha de la pantalla van a ver un icono de un globo, presiónenlo, va a aparecer interpretación de idiomas y luego elijan el canal español. Si están en un iPhone o un teléfono inteligente, a mano derecha de su pantalla van a ver la palabra más o van a ver 3 puntos. Van a presionar esos 3 puntos o la palabra más y va a aparecer interpretación de idiomas y elijan el canal español. Gracias. En este momento empezamos la interpretación.
Awesome. Thank you, Maria. Just for anybody just joining us, thank you all for joining. We will be introducing our speaker for today. So Dr. Gonzalez, our board director for the Latino Health Forum, will kindly introduce our next speaker. Doctor, por favor.
Gracias. Yes, I'm Enrique Gonzalez Mendez. I'm a family doctor at the Southern Residency Program and a clinical professor UCSF at the residency, but we are associated with UCSF. And I've been the chair of the Latino Health Forum for too long, 29 years. So if anybody younger than me would like to try, please let me know. It's a very rewarding event, but this is hard because it requires time. But thank you to the board, the Latino Health Forum that have been helping so amazingly for so long. Well, today I'm especially happy because I'm introducing someone that I admire that is a lot younger than me, but has done so many things and keep doing so many things. And that's Dr. Jeff Reynoso. He's the executive director of the Latino Coalition for Healthy California. That is the state leading health policy organization advocacy for health equity in California's Latinx community. In his role, he is responsible for strategic leadership and external relations, fundraising and financial management, organizational development, and delivering on policy advocacy and programmatic initiatives. For over a decade, he has worked on health equity and social justice issues, spanning academia, government, and nonprofit sectors at local, state, and national levels. Most recently, he was a doctoral fellow at Kaiser Permanente, and he was designing innovative programs to address food insecurity in the Southern California region. Dr. Reynoso holds a doctorate in public health from Harvard University, a master's in public health from Berkeley, UC Berkeley, and a BA from UCLA. Just for you to know. So it's amazing. Probably you've been spending half of your life studying. Dr. Reynoso currently serves as a board member for the the Uninsured project, and he has also been tapped to serve as a multiple advisor boards, including advisory member to California Department of Public Health, Community Vaccine Advisory Committee, Governor Gavin Newsom's Master Plan for Aging, Equity Workshop, Work Group at Task Force for Alzheimer's Prevention and Preparedness for Brain Trust California, Health Interview Survey at the UCLA Center for Policy Research, and California Initiative for Health Equity and Action. At the UC Berkeley School of Public Health, Dr. Reynoso has been quoted on issues ranging from health policy, public health, and Latinx health in CalMasters, Los Angeles Times, Politico, Sacramento Bee, and the Wall Street Journal. Dr. Reynoso is a son from immigrants from Mexico and grew up in California Central Valley at North San Diego County. He says, growing up in the working class immigrant family, he experienced firsthand the systemic barriers to equal opportunity for all, and he believes that the future health and economic success of California, and I will say the United States, is tied to achieving health equity for the Latinx community. We can keep going because Dr. Reynoso has done so much, but I will ask him to please give his presentation, and thank you very much for taking the time to be with us, Dr. Reynoso. Welcome.
Gracias, Enrique. Thank you for that introduction. And you walked through my entire bio. I wasn't expecting that, but thank you so much. And thank you to the Latino Health Forum. I wish we were in person and, you know, we could be together in familia in Sonoma, but maybe next year, right? Hoping for the future. So let me share my slide deck, and hopefully you all will be able to see. Does this look good? Maybe a thumbs up. Perfect. So buenas tardes a todos. The title of my presentation, as was shared earlier, is Protecting and Advancing Latinx Health Equity During COVID-19. We share a close bond with the Latino Health Forum. Our former board chair is someone that I know Enrique knows well, Dr. Mary Maddox Gonzalez. And she was the one who had the vision, I guess, of hiring me almost a little bit over 4 years ago. And so, I had the opportunity to work with Mary, and it was such a great mentorship and partnership to advance our mission and vision at the Latino Coalition. So I wanted to start there to share a little bit about who we are as an organization and how we do our work. The Latino Coalition for Healthy California was started in the early 90s, and our mission is to advance and protect the health of Latinos through policy and advocacy to create healthy communities in California. So we really think that policy and advocacy is fundamental and central to advancing Latino health equity. And our vision is to eliminate the inequities that exist among Latino communities in California. And one of the reasons for that is we see from the data that the social determinants of health matter. And a little bit of a definition here, and this is from Healthy People 2030, which is a national strategic plan to address health disparities in the United States. They define the social determinants of health as the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes. So the social determinants of health, they interact with one another, and you see a few different domains that they define here, from access to quality education, to access to economic stability, access to social and community support, the neighborhood and the built environment, and of course, access to healthcare, high quality healthcare. And why are the social determinants of health important? This is a study, it was a seminal study that was first published in the New England Journal of Medicine in the early 2000s. It's now more familiar to the general population, but what they were able to determine is that upwards of 60% of premature death in the United States is determined by the social, environmental, and behavioral factors. So when we think about addressing healthcare access and healthcare equity, we also have to look at the factors in community health and outside of the health sector. At LCHC, we take a frame that is beyond the social determinants of health, and we advance a health equity framework. This framework was first developed by BARHI, and that stands for the Bay Area Regional Health Inequities Initiative. The BARHI is a coalition of California's Bay Area public health departments, which I believe Sonoma County is a part of that. And what this framework did was it conceptualized and described the root causes of health inequities. So these are on the left-hand side of the framework under that social inequities box. They said that the root causes of health inequities of disease and injury and mortality downstream, which is on the right-hand side, and what they called the causes of causes are classism, racism, xenophobia or anti-immigrant sentiment, sexism and homophobia, ageism. So all of the isms ultimately impact how we structure society, and that how we structure our laws and our policies, and that ultimately impacts how we structure our communities at a local level. So at LCHC, we use this framework for the work that we do to address health disparities for the Latino community in particular in California. So I'll start with our communication strategies, and this is within our communications department. We really think in order to address what we talked about earlier, which is racism and xenophobia or anti-immigrant sentiment, particularly for Latinos and all the other isms, we have to change the narrative around Latinos and who we are in California and our contributions to California and to the United States and to the globe. So we do this through strategic communications. And this is an example. I'm actually going to share a little bit more later on in the presentation, so I'm not going to spend too much time here. But we have multiple campaigns, pre the COVID-19 pandemic. We had campaigns around health for all and ensuring that we recognize the contributions of undocumented immigrants in our state so that we can pass policies like health for all, which is expansion regardless of immigration status of our state's Medi-Cal program. I will talk a lot about multiple components of LCHC, but if you're interested in learning more, I definitely encourage you to go to our website. We actually have a new website that we launched earlier this summer. We have a lot of information and fact sheets and downloadable information where you can learn a little bit more about the work that we do. And this is our latest campaign. It's a partnership with 5 community clinic systems across the state of California. It was funded by the federal government through HRSA, the Human Resources and Services Administration. We're trying to reach the remaining unvaccinated Latino communities by using strategies that are by Latinos and for Latinos. The name of the campaign is called Ándale que esperas. We're working really closely with Ultimate Health Services. They're a large community health center network based in LA and Orange counties. And I actually invited my colleague to share more around the campaign and how you all can get involved later on in my presentation. So now we're going a little bit further downstream. This is the institutional inequities box. So these are the laws and policies that determine how we pattern our society. And within this box, the types of interventions that we advance at LCHC are strategic partnerships and advocacy. So we do this in multiple ways. At LCHC, we believe that policy should be rooted in a community-centered approach through systematically leveraging community input at all stages of the policy development process. We do focus on, we are based in Sacramento, and so we focus on policies that are being passed or debated at the Capitol in Sacramento that have an impact, obviously, statewide. This is a copy of our Latinx health policy agenda that we develop every year. I did want to share just a couple of highlights that I thought might be interesting for this group. The first is Health for All. So we are part of the steering committee for the Health for All campaign, and we are so excited and so thrilled that the governor and the legislator agreed to pass Medi-Cal to all seniors and adults 50 plus, regardless of immigration status. It has been nearly a decade of advocacy to ensure that we got to this point. And starting next year, there will be an expansion of Medi-Cal to these population groups. So really important work done there.
Just to interject really quick, I'm sorry. Maybe we can take a quick pause just for our translation.
Oh, absolutely, yeah.
Catch up a little bit. So
I'll take a water break while we catch up.
Thank you all for your patience, and thank you all for tuning in to the Spanish translation. Hopefully this helps you a little bit, Maria.
Okay, perfect. The second policy I wanted to highlight that we were co-sponsor of is the California Health Equity Fund. So this is AB 1038. And the purpose of AB 1038, we saw during the pandemic the importance of community-based organizations in helping share information through trusted messengers at a local level in communities. So we really took this idea to heart and worked with our partners at the Public Health Institute to develop a bill that would develop long-term sustainable funding for community-determined strategies to address the social determinants of health, ultimately to improve health and address health inequities. The third policy, we're very active in the Food for All campaign, and this is SB 464. This is now a 2-year bill, but it advanced pretty far in the legislative process this year. And the purpose of this bill is to modernize the California Food Assistance Program to provide access to nutrition benefits regardless of immigration status. So ensuring that all of our communities have access to food benefits because at a federal level, our SNAP program or CalFresh blocks out undocumented immigrants. And as we know in California, and I'll share a little bit more, immigration status is still continues, unfortunately, to be a barrier to access to social services and healthcare services. And then finally, we've been a long advocate of the use and leveraging of promotoras or promotores or community health workers, a workforce that is community-based to help with addressing the social determinants and care navigation within the healthcare system. And under the governor's budget this year, there was a budget to advance a policy that would ultimately allow CHWs to be part of a benefit under Medi-Cal. We just got word this morning that the benefit will start next summer, July 1st, 2022. We sit on a working group that's advising the Department of Healthcare Services to make sure that that policy is being implemented and is inclusive of Latino members of our community. I won't spend too much time here, but I do want to share, just to give you, I'm sharing just a snapshot of the policy work that we do at LCHC, but wanted to share a little bit more around how we do our work. We do it all in coalition. We worked with dozens and dozens of parallel partner organizations across the state to advance our Latinx health policy agenda every year. We also have the fortune to be nominated to key advisory committees and task forces with the state of California to advance various issues that are of concern or of priority to the governor's office and the Health and Human Services Agency. So I think in my bio earlier, I mentioned the work that we did with the Community Vaccine Advisory Committee, which guided and advised the state on an equitable vaccine rollout. I'll talk a little bit more about that later in terms of a case study. But we also sit on committees to advance oral health, behavioral health. I mentioned the Medi-Cal community health worker stakeholder group. So a lot of opportunities for engagement, and if any of your organizations, if these issues are of interest, definitely connect with us. We always look for new partnerships to advance our policy agenda. And 2 weeks ago, we convened our policies and programmatic stakeholders across the state at our Latinx Health Policy Summit. Hopefully some of you were able to tune in. We had a great turnout and had the fortune of having a panel discussion with our first Latino Health and Human Services Secretary, our former Attorney General here in California, Javier Becerra, and our Health and Human Services Secretary for the state of California, Dr. Mark Galley, had a really great discussion on opportunities to advance Latinx health in the state of California, both at a statewide level and also at a national level. So now I'm going to go a little bit further downstream in the health equity framework. And at LCHC, we also understand that we can't just be in Sacramento doing policy work or doing communications work through social media. We have to be grounded and rooted in community. And we do this through our programs arm and our programming, where we build local capacity and leadership development to advance civic engagement for the Latino community. So at LCHC, we strive to work alongside our Latino community to amplify their leadership capacity and build healthier communities overall. Our signature program that I'll just highlight really briefly is our Health Ambassadors Initiative. This has been a multi-year project with and a partnership, again, with the Center for Wellness and Nutrition through the Public Health Institute and the California Department of Social Services. And through this program, we train local leaders, adults and youth, on the social determinants of health, and specifically develop them as leaders in their communities to advance policy and systems change. Because the partnership is with the Department of Social Services through the CalFresh Healthy Living branch, the ambassadors focus on the food environment and increasing access to physical activity, but they also address a wide range of health equity issues. Every year for the last couple of years, we've also been doing a community listening tour. So we understand, and in order to advance a Latino Latinx health policy agenda and advance priorities in Sacramento every year, we also need to learn and hear from community members. And so this past summer, actually, we had focus groups in partnership with local CBOs in the following regions to garner input from local community members and community-based organizations that serve the Latino community to listen and learn what those priorities are and what those issues are that the Latino community wants us to focus on. So this past summer, we were in LA, Orange County, San Diego, Inland Empire, Central Valley. I am well aware that due to funding and time limitations, we weren't in Sonoma. But if Latino Health Forum or other organizations that are here today are interested in partnering with our community listening tour next year and want to be a part of that, definitely reach out to us and we'd be happy to discuss potential partnership. So now I'm going to pause for a brief moment, and I'm going to go into the second part of my presentation. So I kind of talked a little bit about who we are as an organization at LCHC. But before we get into what we did in terms of the COVID-19 response, I think it's really important to just kind of level set and ground ourselves in the status of California Latinx health. So a couple of slides with some statistics around demographic information around who Latinos are. Latinos are the plurality racial ethnic group in California. So as many of you know, this is no surprise. In 2021, 40% the state's 40 million population are Latino. So nearly 15 or 16 million Californians are Latino. And this is only expected to increase over time. One of the things I want to highlight here is the issue of race and intersectionality. Latinos, as we all know, are multiracial. We come from countries and our ancestors come from countries that are indigenous, but similarly to the United States, we are also a product of the genocide of indigenous people and the colonization of multiple areas across the Americas. And we also have, a long history of slavery and the import of African populations into the Americas. So when we think about Latinos in this context, in this frame, it's really important to discuss and uplift the fact that Latinos are not a monolith, and we are a multiracial community. And I think this is actually shown very well in the latest census data that and the initial analysis that have been done. There was an analysis that was published by Manuel Pastor out of the University of Southern California around the latest census figures. And one of the things that was pretty, I think, enlightening from the latest census is that the share of Latinos in the United States who identified their race as white in this last census fell from 53% just 10 years ago to 20% in 2020. And the share that identified as other rose from 37% to 42%. And those that shared identified as, or who identified as having more than 2 or more races jumped from 6 to 33%. So what's going on here, right? One of the factors that may be at play is that this latest census had multiple boxes for the white category, and the white category and those boxes did not include countries from Latin America. So it's possible that that may have had an effect. Another potential factor that might have impacted how Latinos in the United States self-identify is the political climate. As we all know, between 2010 and 2020, there was the prior administration was extremely anti-immigrant. I would even argue anti-Latino. And I think this is probably another factor of why we see a shift from Latinos, kind of recognizing ourselves, right, that we maybe aren't part of the broader white population in the United States. There's also a movement that's been, studied by multiple scholars in sociology and other fields, that younger Latinos in the United States are identifying with other racial ethnic groups in solidarity and in alliance with the African American community, with the Asian American Pacific Islander community. So many of you may be familiar with the term POC, or people of color. And I think in light of the racial unrest in response to the murder of George Floyd last year, I think we see this in the latest census data. This is data from a survey that was conducted of California voters by the UC Berkeley Institute of Governmental Studies. And they asked the question of Latino voters. So, Latino voters, obviously not all Latinos are registered. So this is obviously a subset of the population, but they posed the question, people, and this is the question that they asked. People sometimes use different ethnic labels to describe their heritage. How often do you use the following labels to describe yourself? So I think you see a variation, right? When we ask, when the researchers ask or the pollsters ask, do you identify as Hispanic? About 38%, 26% said yes, very often or sometimes. Do you identify as Latino or Latina? Again, about 35%, 25% said very often or sometimes. Latinx, a little bit less so, smaller figures, 12% said very often, 12% and sometimes. But one of the things that they found was that a marker or driver of how Latinos identify, 2 markers are age and political affiliation. So younger age groups are more likely to use Latino and Latina, Latinx. Also more progressive rather than conservative, Latinos are more likely to identify as Latinx. So I think this is no surprise. So I'm really curious, we have a good group here, and I know it's really hard to, have this virtual engagement, but I wanted to give you all an opportunity to just pose a question to you all. What term do you use to describe the Latinx community? So Latinx is the term I use, but curious what term you use. And so we'll take a moment, maybe about a minute. If you can just type it in the chat box, and we'll give it about a minute and then see what folks say. Okay, great responses. I'm seeing a lot here. So a lot of Latinx, Latino, Latina, a few, less so Hispanic, but also represented. I also see representation here, Mexicano, Mexicana, so more country specific, okay. I like this one. I think it was the Yesenia, depending on the age group that I'm talking about. So yes, it can be contextual and specific. And, one of the things that Mexican American, of course, maybe I'll give it about a second or two, and then I'll move on. So one of the things that is true around identity, and, particularly when we think about race and ethnicity, is that it's socially constructed, right? So it's always evolving, it's always changing. And we are still a pretty young community. And this is actually the next slide. Within California, Latinos are younger compared to other racial ethnic groups in California. I think this is really important when we think about public policy in California. 41% of California millennials are Latino, and 52%, over half of all California kids are Latino. So I think, it's a young population that's changing, that has multiple, immigration and family histories. And it's likely that how we define ourselves as Latinos and our place in California in society will change over time. The proportion of Latinx seniors in California will also increase over time. So we have a large young population today. If we look, to the future in 2060, about 1/5 of the Latino population will be older than 64. I'm gonna not spend too much time on the next couple of slides, but just some data around language. Most immigrants in California are bilingual. About 69% of California immigrants report speaking English proficiently. That being said, about 34% of Latinos did self-identify as speaking English less than very well. So again, language access is still a barrier for many of our members of our community. Latinos and immigration status. So I think when we think about the narrative of who Latinos are, immigration always comes up. I think many of you, I think one of the points of frustration for me when I hear about Latinos in the federal context, particularly around policies and around policy and campaigns, particularly at the presidential level, is that oftentimes when they talk about public policy, they just focus on the immigration policy issue, right? Which is important, but when you actually poll Latinos in California, it's not the top reason for why they choose one candidate over another candidate. The top reasons, no surprise, are healthcare, the economy, and education. So we're no different from other Americans. That being said, the issue of immigration and immigration reform, immigration policy is still very prevalent and important for our community. Over 52% of California's immigrant population are naturalized US citizens. About a quarter are green card or visa holders, and then about another quarter, a little bit less, are undocumented immigrants. So that's a total of about 2.35 to 2.6 million of our California Latinos are undocumented. And within California, Latinos aren't concentrated, right, equally. I think we know this. This is data from Pew Research. It's taken a national spotlight, but we see that Latinos are concentrated in the Southwest. Within California, We're concentrated in the inland regions of the state and also in Southern California. And then these are the counties with the largest concentrations of Latinos. Latinos are more likely to live under the federal poverty level. Again, I think this is no surprise because of this next slide that I'm going to show. We are overrepresented in essential occupations. And I think during COVID-19, I think this is one of the narratives, right, that emerged out of the COVID-19 pandemic, in that for the first time, I think many Californians, many Americans saw the role that Latinos play in the workforce, and specifically in the essential workforce. So this is data from UC Berkeley Labor Center. They basically examined the top 15 essential occupations in the state of California, and then they basically analyzed them by race, ethnicity. And what we see here, no surprise, our community, our gente, they are farm workers, they're construction laborers, cooks, food prep workers, laborers, truck drivers, those in distribution, stockers, cashiers, those in janitors and building cleaners. So we're overrepresented within these occupations. So from a public policy perspective, ensuring that we're achieving economic justice for Latino communities is one factor that we need to address when we think about broader healthcare disparities. And despite all that, it's a complicated story. This is pretty new data from about a week. I believe this was released about a week or two ago. And what this data showed is that despite being overrepresented in those essential occupations, and despite being more likely to be low SES, the Latino contribution to the US GDP is tremendous. In 2019, the Latinx share of the US GDP was 2.7 trillion. So 2.7 trillion, that's kind of a hard number to kind of grasp, but they did an analysis by country GDP. And what they found was that if US Latinos, if we were our own standalone country, we would rank 7th largest economy in the world. That's tied with France. So just to give you a sense of, our population size and our contributions to the economy, it is significant. And it's why, we do the work of at LCHC ensuring that all policies are Latino health policies, and ensuring that those policies are centering our Latino community and providing better conditions for our Latino community. Just a couple more slides before I get into kind of the meat of the presentation, which is the case studies around COVID-19. But this is no surprise. Data from California Healthcare Foundation, Latinos are more likely to still be uninsured. And this is, because of immigration and occupation status. We expect this to decrease. The 12% figure of uninsured of Latinos, we expect to decrease with the expansion of Medi-Cal to those 50 plus in the population. Latinos are more likely to report being in fair or poor health. So you see that in the top bar, about 18% of Latinos and about 4% of Latinos report being in fair or poor health. We know that what's driving this is a lot of chronic conditions. Latinos are disproportionately impacted by asthma and respiratory diseases. And we know that what's driving a lot of this is air pollution, which continues to be the largest environmental health risk factor in the United States. And it's linked, as we know, to cardiovascular problems, respiratory illness, diabetes. And now we even know with COVID-19. And this is because of where we live, right? Taking a root cause analysis, asthma is associated with residential proximity to freeways, major roads, and industrial facilities. This is an example from LA County and the Inland Empire, where Latino communities are over-concentrated along the 710 and 60 freeway. And according to Cal EPA, we know that diesel, PM, is responsible for about 70% of California's air population, and that's related to cancer risk and premature death. Latinos are also disproportionately impacted by being overweight and obesity due to the higher likelihood of living in food deserts or food swamps, having less access to clean water, and lower access to parks and safe communities. Again, it's a complicated picture. Despite all of that, right, we talked about all of those chronic conditions, lack of access to healthcare. Despite all of that, Latinos, when we look at mortality, and this is called the Latino paradox, a lot of this work has been done by former mentor of mine, or still mentor, Dr. David Hayes Bautista at UCLA. Despite all of that, Latinos still live longer than whites. I will put an asterisk on this slide. There has been some recent data, and I wish I had some time to include it. I didn't have the time, but there has been some recent data to show, because of the COVID-19 pandemic and its disproportionate impact on Latino communities, we actually lost some of that mortality advantage. So, more to come on this, and I think we're still learning more. So now I'm going to transition to the last part of my presentation. I'm taking a look at time. Looks like we're still good. This is the first case study. So I'm going to be presenting 3 case studies to show how and exemplify how the Latino Coalition for Health of California addressed the COVID-19 pandemic. So this is just, a couple of case studies to show how when we think about the Bar-High framework that I've been showing earlier, how we took a policy approach, how we took a programmatic approach to ensure that despite all of the challenges that happened, we weren't in the worst, situation that we could have been. This first case study is around the establishment of California's health equity metric, and it specifically focuses on the allocation of the COVID-19 vaccine. So for some data, this is the most recent data from the Department of Public Health. Many of you that have been working, on the front lines of the response to COVID-19, this data is no surprise, right? Latinos were and are overrepresented in cases and deaths. 53.3% of cases, 45.7% of deaths. Of those, there was no community that was more impacted from COVID than the Latino community, and we also lost the most. 31,159 of our community members, of our family members lost during the pandemic. We're starting to see some analysis of the mortality and what were some of the drivers, right, and the risk factors. And this is a study from some researchers at USC, and what they found, which was pretty interesting, because I think it tracks with what we know in terms of the qualitative data that we were hearing from our community members and our community-based partner organizations across the state, is that what was driving the Latino inequities in the COVID-19 pandemic was this issue of essential workers, right? And being further exposed or more greatly exposed to the pandemic. And what they found was that there were greater disparities among younger age groups. So working age adults, millennial population in particular. So I think this was pretty illuminating from the study. So, we were hearing that, right, from a qualitative perspective in the early days of the pandemic. And back in April and May, we were hearing from our CBO partners across the state, community health centers that we work with, community members, all of our staff are Latinos from our own family members. We were hearing what those challenges were in the early days of the pandemic. It was trying to get the appropriate PPE, right, in work sites. It was trying to get access to testing and, better culturally competent contact tracing. And so we knew that, a vaccine was coming. So what we did, we worked with our coalition partners and submitted a letter to the governor's office. And this is why advocacy is really important. We developed basically a Latino health perspective to what we saw was an equitable COVID-19 response. The letter included 3 key domains. The first was rapid response. The second was direct service provision. And then the third was long-term recovery and resilience from the pandemic. And one of the recommendations, actually multiple recommendations that were included in the letter, these are on in the blue here, we said we need to utilize existing data that incorporates the social determinants of health so that any type of state response is data-driven and addressing the needs of our community. And we mentioned that the Public Health Alliance, which is a coalition of the Southern California Public Health Departments, already had a tool called the Healthy Places Index to do just that. We also said, once a COVID-19 vaccine becomes available, the state should ensure equitable distribution and access to low-income and communities of color, including Latinos. And once the vaccine became available, they needed to report publicly the vaccine COVID data by race, ethnicity, and age. So fast forward, so this was May and June of 2020. Fast forward to 2030, multiple conversations and advocacy, Latino Coalition and some of our other partners, the state of California, through the governor's office, announced that they were going to implement what they termed a health equity metric. So this is what this is, data from the state. And what this shows, if you look at the left-hand side of this bar, so overall, what this shows is the number of individuals that are vaccinated with at least 2 doses of Pfizer or Moderna, or at least 1 dose of the Johnson & Johnson vaccine. On the left-hand side, it's the early days of the pandemic. So that's January when the vaccine was first available to essential healthcare workers. And then as we go to the right, it's going through the preceding months or succeeding months. What the colors represent are the zip codes across the state of California. So these are what they term the quartiles. The zip codes that are in blue are the highest need zip codes. So these are the zip codes where we see more Latinos concentrated. The zip codes in green are zip codes with higher resources, higher access to education, to employment, to healthcare. And what we saw in the beginning of the COVID-19 rollout, if you see, there's a lot of green. So a lot of the early vaccines were being allocated, no surprise, to those that had the most means. If we look at the data here, so that's the first kind of dotted line, that was early March 3rd, actually March 2nd. That's when the governor's office started the health equity metric allocation. And what we saw, just that one simple policy decision, which we advocated for, almost a year before the decision was made, we started to see a closing of the gap. So if you look at the data today on the right, the majority of vaccines are now going to those highest need zip codes. So, I think this is one example of how advocacy matters, ensuring that Latino voices are at the table being heard by decision makers matters, and that ultimately impacts communities across the state. But we also understand and we know that allocation is just one component, right? Allocation doesn't equal access. Access meaning that our Latino communities actually have the information, they actually have the transportation to a vaccine site, right? So we need to think about what other methods and interventions we have to employ to make sure that we close the vaccine equity gap. So that leads me to the next case study that I wanted to present today. And this is our programmatic response at LCHC, which was ultimately called the Pasa la Voz COVID-19 vaccine campaign. So the challenge that we were seeing in the initial days of the vaccine rollout is that there was a trust gap, right, in government with Latino communities. And, that's no surprise, right? Just a few months earlier, we had a federal administration that was scapegoating our community, that was, trying to, for example, add an immigration question to the census, was trying to restrict access to public benefits through the public charge ruling. So, just a few months earlier, right, we were telling Latinos, be distrustful of government, or government was telling that to us, right? And then COVID-19 hit, and now we're telling Latino communities to, change their minds and start being trustful of government again. It doesn't happen overnight. This is data for Kaiser Family Foundation, and what they did is they did an analysis of how does vaccine hesitancy look like between Latinos compared to other communities, and what are the driving factors there. So the challenge that we saw here is in the early days is even though the vaccine is available, Latinos have lower access to healthcare, but they also have a greater mistrust in the COVID-19 vaccine. What was important in the data is that we found that younger Latinos had higher levels of mistrust. In terms of what sources Latinos trusted the most, younger Latinos did have those higher levels of mistrust, but we also needed to tap into who they did trust. And what the data showed was that the majority of Latinos trusted healthcare providers and institutions like the CDC, like local health departments, community-based organizations. So we really use this data to guide how we were going to respond in terms of our communications and outreach through our communications department. So we partnered with the state. The state of California invested in several hundred organizations, CBO partnerships through millions of dollars through the Sierra Health Foundation and the California Community Foundation. And what they did was they recognized, to their credit, that they can't do the COVID-19 vaccine allocation and outreach alone. And they needed trusted messengers from the community to help overcome some of those trust gaps. So at LCHC, through our Pasa La Voz campaign, which was, our first iteration of this campaign, we partnered with trusted messengers. And what we know is those trusted messengers are community members themselves. So we contracted with a network of promotores, promotoras, and these promotores are, as many of you know who you work with promotores, are community members that already have that longstanding relationship in the community. They already know how to speak the language, and they understand those cultural nuances to overcome any hesitancy, right? We also knew that we needed to develop trusted messages. So it wasn't just about the messenger, but the messages themselves. And this was really critical because when we were seeing the data, right, that younger Latinos were the most distrustful compared to Latino seniors, we knew it was important to also contract with millennial promotores, right? So that we could develop those messages that we're promoting with members of my age cohort. And then finally, it was also using and tapping into trusted communications channels. So this was the third component. For our older Latino community members, those that are in their 40s, 50s and up, they're on Facebook, they're on WhatsApp, and that's what the promotoras that were tasked with that population group use. For younger millennials, they were more likely to be on Instagram, so we really employed methods like Instagram Live, using Twitter to share information that's by Latinos for Latinos, that's database, research-based, and is accurate, but also speaks to our communities in their language and their culture. Every single one of, and the images you see here are from some promotional materials from our Facebook Live and Instagram Live Pláticas. We partnered with some key voices and physician voices in the Latino community. I think many of you know Dr. Ilan Shapiro from Ultimed. One of our promotoras partnered with him in a Facebook Live. And all of our Facebook Lives, we were able to reach some of the most hardest to reach populations across the state of California. So we did focus in our priority regions that we know from the data we received from the state were the regions that had the biggest gaps in terms of vaccine inequity. So we did focus there. Every single one of the pláticas, these run every week, and they've been running for about half a year now. They reach anywhere from 500 to 1,500 live views. And every conversation is a new conversation. And one of the, I think the beautiful aspects of the Pasa La Voz campaign, it's a two-way conversation. So not only are we sharing information with the community, but the community is also sharing information with our promotores, and they're sharing their struggles or challenges. Messages like, I heard that I know for a lot of the younger Latino populations, we were hearing, for example, that the infertility issue was huge and it continues to be huge. So we adapted our messaging to better address those issues. So, I think I'm going to pause here because I'm taking a look at time, and hopefully my colleague, Lizette Escobedo, is on the line. I'm going to hand it over to her to discuss the third case study that I wanted to share, which is our newest venture with Ultimate Health Services and a HRSA-funded campaign called Ándale que esperas. So we're at that stage in the vaccine rollout where those who wanted it pretty much got it. There's still some access challenges with employers, ensuring that employers are providing the time for our community members that are especially essential workers to have the time to take off and get the vaccine. But we thought it was really important to partner on this effort because community health centers are, in addition to promotores and promotoras, community health centers are those trusted messengers in the community. So with that, I'm gonna stop sharing my screen and hand it over to Lizette. And just a little bit of background, Lizette is the Vice President of Civic Engagement for Ultimate Health Services. She was formerly with NALEO and led the national campaign for the census outreach for Latino communities. And with that, handing it over to you, Lizette.
So really,
thank you so much, Jeff.
I do want to just cut in really, really quick. If we can just give a quick, maybe like Jeff said before, a quick little water break for our simultaneous translation to catch up. So Lizette, just so you're informed, if you can pause every now and then and speak a little bit slower than usual, that will really help out our Spanish interpreter who is doing simultaneous Spanish translation on the line. So let's give a couple more seconds for Maria to catch up and maybe we can get started. Gracias, Maria. All right, looks like we can get started. Thank you.
Awesome. Can everyone see my screen in PowerPoint format? Awesome. Okay, I always mess it up. So as Jeff mentioned, my name is Lizette Escobedo. I'm the Associate VP of Civic Engagement Advocacy at Ultimed. I've been with Ultimed for about 5 months now. And as Jeff mentioned as well, prior to that, I actually ran all of the Ya es Hora campaigns at NALEO, worked at Mi Familia Vota for a while. And so what we really wanted to do with this effort is bring in what we've learned from a lot of these campaigns and how, and like the layered approach to reach mass audiences in a culturally relevant way. And so I'm going to kind of take us through how we built this campaign, right? And what was the purpose, what is the intent, and also the structure of how we did it. As many of you know, one of the things that our civic engagement work focuses on is addressing the social determinants of health. COVID-19 being, one aspect of this where it impacted Latino communities the most. And so we wanted to hone in on this kind of roots of social justice in the work that we did through our community health centers. And so community health centers are a really key component to this campaign. And I'll talk about that a little bit more. My apologies. I realized that I've started going very fast, even though you told me to go slower. Try to go a little bit slower. And I just wanted to kind of skip through, I talked a little bit again about how we're using our civic engagement structure to do this work. And this is because, with a lot of the civic engagement and kind of social justice work, our intent is really to reach mass Latino audiences in a culturally relevant way. And so we wanted to take everything that we've learned from reaching Latinos where they're at, right? Not just in the community health centers, but also in the surrounding areas, right? What do they consume? How do they consume it? What are the messages that work for them? What are the messengers that work for them? We applied all of this into the Ándale que esperas effort. The goal of this campaign was to reach 4.5 million Latinos across the state of California, hire on between 75 to 150 community health workers so that we're building capacity as we're addressing the issue of vaccines. Provide 225,000 support services to Latinos experiencing barriers to vaccine access across the state. One of the things that we've learned is that aside from all the issues, right, in our communities in terms of COVID response and being affected by COVID and a whole slew of issues, right, socioeconomic issues, is that a key barrier to vaccine access has also been, you know, getting a ride to the vaccine location, making sure that I have access to childcare, making sure that I have access to other key services that are just as important, right, as this access. And so this became an important component to our work. And ultimately, we want this to lead to 450,000 vaccine appointments. Now, even though, you know, Altamed has its clinics throughout LA and Orange County, we wanted to use the model that we've used for our civic engagement work in terms of organizing in the clinics and externally to the clinics and the communities to onboard new partners, train new partners, build capacity, and in essence, make this a statewide campaign. And so through the partnerships that I'll talk about in just a couple of minutes, we've been able to reach not just LA County and Orange County, but San Diego County, Contra Costa, Alameda, Merced, Stanislaus, and Solano. And we do this closely with LCHC, and I'll share the structure in just a bit. And I did want to share that, you know, we know that 60% of California, right, has received the second dose of the vaccine. So we know that 40%, right, is kind of what we're focusing in. And so these are the folks that require additional effort, right? They require non-traditional approaches. They require more than a 5-minute conversation. And so we really had to layer in all the components of what a campaign takes to move a community, right? So instead of just building kind of a moment of let's get someone to a vaccine, we wanted to build an infrastructure that would create a movement towards the journey of getting the vaccine, right? And so we did this by onboarding 5 community partners throughout the entire state, as I mentioned. So when I mentioned the counties, we actually subgranted to Latino Health Access in Orange County. We subgranted to San Isidro Health that covers San Diego County, Golden Valley Health Centers that has about 43 community health centers across Central Valley, La Clínica de la Raza in Northern California, and then lastly, Altamed, who serves about 400,000 patients in both Orange County and LA County. They are our direct connection to the community, right? The folks where the community can go to get a vaccine and also to talk to a community health worker about any concerns around the vaccine. Now, because there's so many organizations kind of doing this work, we required statewide coordination and communication so that we can organize this all under one campaign umbrella. And that's the Latino Coalition for Healthy California. Jeff and his team, who have been great at really keeping us all coordinated and on message. Parallel running to this was a completely branded campaign effort that included not just campaign design, which you all are seeing as part of these slides, but it also included creative components, right? Social media graphics, video content. We do Instagram lives every Thursday. And then a full-on paid media campaign, both paid and earned media campaign that honed in on our target audience for this particular campaign, which was Latinos. So we had to look at what do Latinos consume in California, right? And especially within the age group that we were looking at, which is 18 through 35. And we put in our ad buy dollars there. We also build up a call center where folks can actually call to make an appointment, get their questions answered, fully bilingual operators and live operators with extended hours. Our call center is an operation between from 7 a.m. to 8 p.m. Pacific time, and on the weekend, 7 a.m. to 8 p.m. Saturdays, and Sundays it's more limited hours to that. But overall, all of the callbacks are between 24 hours. So our hotline is 855 Ya Andale. I always tell folks, if you remember nothing else, right? Remember 855 Ya Andale. If you're out in the community, you're out with your family, someone needs a vaccination appointment, it's a lot easier to just remember 855 ya andale than, .ca.gov or, a phone number that's 1-800 and all these other numbers that you might not remember. And so we intentionally made this vanity number that connected back to our call center. Every ad buy, every t-shirt, every poster, every earned media piece, pretty much every visual that you see as part of this campaign includes this hotline number, so that there's always that connection back to an actual appointment, which is the goal of our effort. And so everything that I explained is captured in this visual here. It's a strategic approach, right, to how we traditionally do campaigns, but this time connecting everyone back to the call center to lead to an appointment or to lead to a connection to one of the community health centers. And just one example, we actually just finished a tour with La Liga Mexicana, where we partnered for a Chivas game, an America game, and Pumas game, and fully branded the stadium with the hotline number, the brand, and videos playing throughout the entire game, so that we can get someone on the path, right, towards getting their vaccine. And so again, just repeating the number here. And I think it's really important to understand that part of the effort that we've been trying to play by really having the community see the message, hear the message, and hear this call to action, right? Ándale, que esperas, right? Come on, what are you waiting for? Is really an effort to, yes, immediately generate vaccine in arms, right? Immediately generate appointments, but to also get a lot of those folks who maybe have been thinking about it for a while to not be able to escape the message, right? You go to your clinic, ándale, que esperas. You go to your supermarket, there's a community health worker there saying, ándale, que esperas. Go to swap meet, the singer that's singing, right? We actually brought on an influencer, Alex Arellano, who does a lot of his concerts in these like mass swap meets throughout the state. The singer reminds you, ándale, que esperas. Turn on the TV, reminds you again. And, hopefully by one of those touches, you'll say, you know what? Yes, what am I waiting for? Let's call. I still do have questions, but I'm going to make that call. And so we like to think of the campaign as part of what gets Latinos into that kind of journey of getting their vaccines. And it's, again, delivered in a very culturally relevant way and having very honest conversations about why someone is or isn't getting their vaccine. I will share that to date in our call center, we've received 1,200 calls. The top reason for hesitation, which is at about 60%, has been, I haven't had time. I have either one job or two jobs, and I just haven't had time to go and get my vaccine. So that message directly resonates with, what are you waiting for? Then we have other hesitations, right, that we address as part of the conversation in the field through the clinics, which includes what are the side effects? Will anything happen to my body if I get the vaccines? And will I have to be off of work, right? And so again, we're having these very honest conversations as part of this campaign effort. And as I mentioned, we have a website, and I know Jeff shared this earlier, andalequesperas.com. There's a video library there. The other cool part of our website is that you can actually make a call directly into the 855 Ya Andale Center by clicking on the button. It's a direct call to, click to call. It has other resources, FAQs. It even has information on how to report disinformation around vaccines so that we're proactively tackling what are some of the common myths out there. It also has, we just included this on the website, where you can fill out a form and say, yes, I want someone to contact me to answer my questions that I still have around the vaccine. And so those all directly get fed into the call center, and we have outbound texts and outbound calls going into the folks who have expressed interest. We have social media built out. If you are not following us already on Instagram, Twitter, Facebook, we just had a day of action where we had tons of activity on Twitter just yesterday, actually. And on Instagram, we have Instagram Lives every Thursday where we have Dr. Shapiro answering all of the questions that you can think about regarding vaccines. We just did an IG Live yesterday with the California Superintendent of Public Instruction, where he answered the questions around the new mandate in California and how that applies to kids and when we should expect the vaccines for the 5 through 11. And so there's constantly a flow of information aside from the digital targeted ads that we're doing through all of our Facebook platforms. Here's just what our swag looks like. Again, you can't escape the branding, and you can't, our volunteers have the shirts on, and this is across the state. All of our organizations receive this. For folks who are interested, we're happy to share some of the swag or even some of the creative design with you all to join the campaign. We have a campaign toolkit. We have influencer engagements. We have some events coming up. Days of action, we just did a big one yesterday. You see my Zoom background, we're fully branded. And again, the idea is message saturation combined with direct action and direct on the ground presence through our CHCs. Paid media, I talked a little bit about this already. We focus on the 18 through 34 in the specific counties that we're targeting. We got really deep into the geocoding, right? And making sure that we're targeting the folks in the areas that they're at. We also do advice for all of the events that our community health centers have. We do geofencing advice, which means that in the radius of where that event is going to happen, people are being served ads letting them know that that event is coming up in case they want to get a vaccine. And so that's been generating a lot of request forms from folks saying, yes, I want to be contacted to learn more about this event. And then we're either sending them to the event, or if they want a direct appointment, we're making the appointment for them. And so again, trusted messengers have been very important for us. We have some influencers that we've been working with. We just did a tele town hall yesterday with Univision that aired throughout the entire state, where we asked folks to call in. And so really all of the multiple approaches to target Latinos with where they're at or find them where they're at, we've taken. So it really has been a comprehensive, innovative, multi-tiered approach to this work. Here's just some information on how can you get involved, right? How can you participate in this campaign? You can promote the phone number, you can promote the website, use our social media toolkits, which you can email us and we can definitely get that over to you. And it's also available on our website. You can host an event with us. You can volunteer, distribute information that we have pre-made. We have tabletops, we have posters, we have rally signs. And lastly, you can contact us and we can figure out how you can join our efforts, but we definitely need each and every one of you for it. And with that, here's my contact information, and I will hand it back to you, Jeff, unless folks have any questions that I can answer.
Thank you, Lizette. Thanks for hopping on, and no one to better explain it than you, the mastermind behind the campaign. One of the things that you shared that just triggered a memory. There was a point in the early days of the COVID-19 vaccine, the advisory committee with CDPH, and they were starting to roll out their strategy for how they were going to reach communities, and they were like focused on the mega centers. I don't know if folks remember, like the Coliseum in Oakland, Dodger Stadium. And I said, yeah, that's great, but we also need outreach in swap meets, in supermarkets. And they like looked at me like I was crazy, right? Like that's where our people are. So I think it's been really such a great partnership. Thanks to the leadership of the federal government in providing that support and giving us the creativity to take a grassroots approach and a campaign approach to reach Latinos where they're at. And with that, I think we're going to hand it over to, is it Pam for Q&A?
Yeah, So I'm just going to give a few seconds for Maria to catch up. Looks like she just needs to catch up on interpretation. So we'll wait a few seconds before we move to Q&A. All right. Gracias, Maria. She is now logging out. So we just had our translation today for our presentation portion of the workshop. We will now move on to Q&A. If you want to submit questions in Spanish, please type them in the chat or in the Q&A session at the bottom. You can use the Q&A icon at the bottom to submit questions, and we'll answer them shortly. We do have a question already submitted by somebody. So just really quick, si necesita preguntar algo, podría usar el chat feature que está abajo, y también el feature question and answer. So let's move forward. So we have a question from somebody earlier who's talking about managing a grant for increasing equity in vaccine access services for specifically older adults and people with disabilities. Do you have any suggestions for how they can initiate more of a local promotores program to increase equity among these populations? Are there any kind of toolkits available for developing these promotores programs?
Yeah, that's a really good question. And I'll preface that with saying we have many years of experience working with promotores, promotoras, and training, providing leadership development support. And there are some other great organizations that have been doing this way longer than we have. I think, so I'll just highlight Visión y Compromiso. They are a statewide multi-state organization. They have a couple of resources on their website. I'll share it in the chat after the Q&A. And El Sol Community Center there in Riverside and San Bernardino counties, they have some great training materials, and they actually have multiple trainings where they work with organizations that are thinking about launching a promotor program. At LCHC, I'll put a plug. We actually have a report that's going to be released in about a month. We're going to have a webinar on how to advance the promotores workforce in California. So it takes a big statewide picture approach, but I will definitely share some of those resources in the chat.
Awesome. And I know some folks were curious. I know that your organization does a lot of outreach in various different areas. And I know earlier you mentioned that you would love to partner with some folks in the Sonoma County area to be able to do some of this outreach that you're thinking about. So hopefully we can see that in the future for those folks who were asking about that. I know that was mentioned earlier in the presentation. So I don't know if you want to speak a little bit more about that.
I saw that question. Thanks for the question. Yeah, I think there's a lot of, well, first of all, the door is open, right? We want to partner with more organizations. Lizette shared a couple of emails. Feel free to reach out to me. I put in the chat. We want to create that echo chamber and voice across the state. I think for the initial partnerships for the Andale que Esperas campaign, it was actually a follow-up from a previous partnership that Ultimate had previously established with the health centers that are part of it for the general elections last cycle. So they've been testing this 5-touch model approach to civic engagement. And Lizette, feel free to share more because I know you know more about it. So it started with those health centers, but I think as we grow and there are more resources available, there's definitely, I think opportunities for partnership. Lizette?
Yeah, and I just wanted to be very clear in that the infrastructure we set up, right, for the campaign is open to every county, right? So if someone calls that number from any county, we'll be able to assist them with an appointment. The only difference is that the community health centers where we provided, we're providing sub-grants and kind of support to, is in those areas that we flagged. And in large part, this was because this is part of like HRSA funding that we got. And in some cases, some of those counties, some of our grantees are already receiving HRSA funding for, right? And so we had to be very careful with like, okay, we're focusing on these counties, but that's the reason that we set up the statewide infrastructure so that no one would get turned away. So the phone number, the website still applies. All of our social media toolkits, folks can use them. You know, even if folks call our website from out of state, I'm sorry, our phone number from out of state, the call center is actually set up to also provide them information on their closest vaccination site using the CDC system. And so no one will get turned away at our hotline or obviously on our website.
Awesome. Thank you. Thank you so much for sharing. And then we will take it back a few steps. I know we had multiple parts to the presentation today. So apologies if I'm kind of going back and repeating some stuff, but I know that you mentioned, you know, having the young Latinx population and being able to reach this specific demographic. And I'm just wondering, you know, in terms of like reaching this specific population, maybe what you were talking about, like the 18 to 35, and just the impacts of what it has on policy, which you mentioned earlier, how, you know, reaching the specific population will then impact the way we're considering policy. And so do you feel like there needs to be a little bit more support for folks in that age group to kind of get into this policy more, to maybe, you know, collaborate a little bit? I know someone mentioned earlier about like this kind of same promotores program, maybe for people who are a little bit younger, for the youth, and so how they can get involved a little bit more.
That's a really great question. You just reminded me, there was an article, it might have been LA Times or Fresno B. There's a Promoteritos program that was just launched in Fresno with Cultiva la Salud. Genoveva Islas, who used to be a board chair at LCHC, she launched that program, and they're reaching like the 16 to like 18 or 16 to 21 demographic. You know, I think it's, you know, it's a tried and tested approach that when you're trying to, you know, share information, you're more likely to receive the information if the person looks like you and speaks your language, right? And that's a fact, right? And more so for the Latino community. So I think that there are opportunities there. At LCHC, we actually have a program called our Health Justice Fellowship, which kind of uses a promotor model, but focuses on civic engagement for health equity. And so we have fellows that we onboard every year, and they support with, you know, with our health policy advocacy in Sacramento and also in their local communities. You know, I think, and then I'll just like also add that there is a shift in California when thinking about civic engagement, just with the recall, the numbers, there was some data out of the UCLA Latino Policy and Politics Initiative, one of our partners, and they were able to track the Latino voter engagement and that younger voter engagement. Some of the programs that have been and organizations that have been doing that organizing work in places like the Central Valley and the Inland Empire, other regions of the state, it's actually bearing fruit. And you saw that sizable increase in Latinos that were registered, you know, got out to vote. And I think Latinos are, you know, kind of coming into their own, right, into their political power. And we know that being at the table and being part of the conversation is how we get better public policy enacted. Lizette, I'll pass it over to you. I'm sure you have some thoughts on that.
Yeah, just to echo what you were saying, Jeff, I think for us, what's been really important and engaging kind of the younger crowd, and actually the initial focus of our campaign was males between the ages of 18 through 34 because of what we were seeing with the vaccination rates. And something that was really important for us is to really not take a one-size-fits-all approach, which I think, you know, Latinos have been kind of fed like all this information, right, from all these like vaccine campaigns or the state or the county from the city. And so for us, it was really important to hone in on where are Latinos at, right? And so interestingly, in our call center, the majority of the calls that we've received are males between the ages of 18 to 34. So I'm like, okay, we're doing something right. And so this is why for us, like the soccer games were very important. The last soccer game that we sponsored, which was America versus Pumas, right? Which is big for a lot of the Mexican community in California. We vaccinated like 40 people on site, including players of Pumas, right? And so that really generated like a lot of excitement within that community. But we have to think strategically in those ways, right? What are we consuming, right? Same thing with when we look at like the influencers that folks are engaging. It's the usual suspects, right? And so for us, we went outside of that and we saw, okay, Alex Arellano is someone who fills up swap meets everywhere in the state. He has a huge social media presence. That is an influencer that we need on board. So he got his vaccines through Ultimate. And we got consent to film all the experience, et cetera. So I think that is really important to understand that as Latinos, we understand our communities best, right? And we know what our communities are consuming, and we know what they're not, right? And we know who the trusted messengers are, and we know those who might not be, right? And so for us, I think that's a really important component. I think to the youth component around the civic engagement work, we saw this in 2020 as well, right? In civic engagement, you know, I'm newer to healthcare. Civic engagement I've been doing for about 13 years. And what we've seen from 2016 and on for Latinos has been something very new, which means that younger Latinos are watching and paying attention. And we also have to think about the fact that they're watching and paying attention for their family too. You know, as a daughter of immigrants, I was the attorney for my parents. I was the interpreter for my parents. I was their main source of information in English, right? And so we also have to look at how young Latinos influence the entire household, right? This is why for a lot of your voter engagement work, when we were doing, when I was, you know, at my time in LA, when we were doing phone calls, we would look down the list when you had the household and you would try to talk to the 18-year-old, right, who just started voting, because you know that they were going to then go to the mom, the abuelita, the tia, and say, have you guys also voted? And so it's really important to start paying attention to those young Latino influencers in their household, because they will carry way more weight than, you know, than even your, you know, your actor, actress can carry by doing a PSA, right? And I think that that's the critical role that young Latinos play, I think is sometimes downplayed, right? But we're seeing them increase in turnout as we go through elections, where they see that their livelihood is on the line here, and where they look at what are the issues that are important to them and how we're engaging them, right?
Yeah, definitely. And I love how you're kind of, in a way, like deconstructing that word of influencer, right, to mean more than what has been probably known as before, and to really like dig deep and think about like, no, everybody that is in our community has influence. Of course, you know, something that I've always thought of is like the word of mouth kind of advertisement for everything. That is like huge in the Latino Latinx community. So thank you both. I know we are closing up on our time right now. I wish we could ask so many more questions. This is a great conversation, but I will leave it at that. I know that Jeff and Lizette have included either contact information or links to some websites for folks that want more information or want to know more about the work from Andale que Esperas or LCHC. So thank you both so much. I will also let folks know that we will be broadcasting the audio for this webinar on KBBF. So you can listen to that tomorrow, actually, not today, tomorrow at 3 p.m. For this webinar. And then I will now hand it over to Dr. Gonzalez to announce tomorrow's.
Thank you, Pam. One last question. If you can briefly tell me, have you used the radio in Spanish? I imagine. Okay.
Yeah.
Here.
Radio and digital have been the one that's worked the best for a younger demographic, digital specifically. But broadcast TV is just constantly changing in how we consume it, where we consume it. Later generations of Latinos, I think we consume English as well, so it's kind of hard to pinpoint it. But radio and digital have been the key components to our campaign.
Excellent. Thank you. Thank you very much, Jeff. And thank you, Lisette, for participating. I hope we can have you next year. The 30 is going to be a big one, the 30th year of Latino Health Forum, hopefully in person. And we're hoping to do a couple days, and your information is so crucial. And your experience, because you are in the trenches, but also you are at the level of promoting policies, and as I said, the politicians listen at you. So thank you very much, and again, we'll hope to see you soon. Thank you, Pam. Well, tomorrow we have again at 12 Pacific time the Las Fortalezas study that is identifying assets, power, and resilience of the Latinx community. It's going to be very interesting because it's going to be a description of the lowest in welfare, education, and income levels compared to other ethnic and racial groups in Sonoma County. So it's going to be a lot of information that you can use in your daily work. We have a great speaker, Richard De Leon. So we see you tomorrow at noon Pacific time. Take care, and if you are not vaccinated, ándale, ya. Gracias.
Yes. Gracias todos por participar y nos vemos mañana al mismo horario a las 12 de la tarde. Gracias.